More Americans turn to cannabis. A growing number of people say that they're struggling to cut back or even quit, and new concerns are emerging about problematic cannabis use and the potential impact on people's health, work, and really just their everyday lives. Joining us today to talk about this more is Dr. Craig Allen, Vice President of Addiction Services at Hartford Healthcare and Medical Director of Rushford. Welcome, Doctor. Thanks for joining us on this Wednesday.
Thank you for having me on. Thanks for your interest in this topic.
Yeah, I'm really interested, Doctor, because I remember when cannabis first started to get legalized in a number of different states. I didn't hear any word about how this was addictive. People always said that this wasn't an addictive substance, but clearly that's not what you're saying. Can cannabis be addictive?
Yes, cannabis is addictive, and it's important to understand that legalization doesn't mean, hey, this is safe. Legalization means easier access, commercialization, and if you're marketing a product, you're probably focusing on the most positive qualities. The other issue with addiction is, yes, cannabis has always been addictive, but the cannabis that is available today is much more potent than it was 20 years ago. And potency and frequency of use equals more risk of developing an actual cannabis use disorder, which is an addiction.
Is there a difference between an addiction and a dependency on something?
Those are semantics, but they're very similar. To meet the criteria for having an addiction, one of the elements is being both physically and psychologically dependent. So if you try to stop or cut down on something you've become dependent on, you might have withdrawal symptoms. And with cannabis, that can be very real. Feeling irritable, having trouble sleeping, losing your appetite, feeling unhappy, dysphoric. And that's something that can often drive people back to using, even if when they're just trying to cut back. So understanding that's important.
Absolutely, yeah. If they're going through a tough period in their life and they might turn to cannabis in order to get them through that. Now, let's talk about some warning signs that people need to look out for if they're using cannabis recreationally. At what point, doctor, does this become a problem?
Well, so here's some of the things that I look for when I'm seeing people. Have you tried to cut back before and struggled with that? Has it affected your functioning? Has it started to be something you take into consideration when you're going to do things with your family or do things recreationally? Have other people been concerned and said something to you about, gee, maybe you're using too much, maybe you should cut back? Those are some of the major things. It's an impact on functioning that I look for. It's not just using cannabis.
Absolutely. So if you do get to this point where you're like, okay, maybe I do have a problem, what do you do?
If you get to that point where you've tried to cut back, other people are worried, you're starting to get worried, talk to a healthcare professional, talk to your primary care doctor, talk to an addiction specialist. There are treatments and interventions that can be very effective. I've had many patients who've had pretty significant problems who've been able to get control over those problems and get their life back on track.
All right, it's good to hear that you can still turn things around. Dr. Allen, we thank you for taking the time today.